Assalamu alaikum. Today's our topic is surface anatomy of abdomen. So as the topic suggests, we are going to study the anatomy of abdomen from the surface point of view. Our learning objective of today is to identify the bony landmarks of abdomen along with the surface anatomy of different organ, liver, gallbladder, spleen and stomach, as well as we are also going to discuss the abdominal regions and quadrants along with how they are made and the contents of each quadrant and region. And the last topic is variable position of diaphragms. In the last, as we always doing the clinical correlation of the topic surface anatomy of abdomen. So in this picture, as you can see, there are the multiple landmarks highlighted with different colors. Let's start with the xiphoid process. As you all know, xiphoid process is basically the terminal part of the sternum, and the abdominal cavity extend from the xiphoid process till the pubic symphysis, which lies at the region of coccyx. So along with the xiphoid process, as you can see, the superior laterally there's a costal margin. So the costal margin is basically formed by the 7th, 8th, 9th and 10th rib. Just below the costal rib you can see a green imaginary line which indicate the subcostal angle. As our learning objective is the bony landmarks of abdomen, so let's stick with the bony landmarks. Initially we start with the xiphoid process, and then the end part is the pubic symphysis, which is made by the two pubic bones fusion. Then come lateral to the xiphoid, there is a costal margin which is made by the 7th, 8th, 9th and 10th rib, because the last two ribs is the floating ribs, while the 7th to 10th rib are attached with the costal cartilage. So after the costal margin you can see there's a area highlighted with the red color, that is the iliac crest, while just below the iliac crest there's a pointer, black pointer, which is indicate the anterior superior iliac spine. Anterior superior iliac spine is basically you can palpate on almost each individual, and as one of our learning objectives are the abdominal regions, so you can see these imaginary lines at the transpyloric plane and the transtubercle plane. These we are going to discuss later when we are going to discuss the regions. So the bony landmarks of abdomen are the xiphoid process, costal margins, iliac crest, anterior superior iliac spine and the pubic symphysis. Now come to the abdominal region. So abdominal regions are basically, we classify the abdominal contents or organs or the boundaries into two classification. One is abdominal quadrants, as name suggests quadrant, which divide the abdominal region into four parts, while the second one is abdominal region, in which there are four imaginary line draws, two from the mid-clavicular regions, while the two at the transpyloric plane, and the one is a transtubercle plane. So after these four lines, the divide abdominal cavity divide into nine regions. The right hypochondriac region, epigastric region, left hypochondriac region, right lumbar region, umbilical region, left lumbar, as well as right iliac, hypogastric, and the left iliac region. So you can see two vertical lines which are present at the level of mid-clavicular line, while the two horizontal, which is transpyloric plane and the transtubercle plane. So these regions are very helpful to divide the abdominal cavity, and the contents we are going to learn in each region. As you can see, there is a right hypochondriac region which consists of the greater part of right lobe of liver along with the hepatic flexure of colon and the part of the right kidney. Now remember, the hepatic flexure of the colon is the ascending joint between the ascending colon and the transverse colon, while in epigastric region you can see the greater part of stomach, including both cardiac and pyloric orifice. Here you can see in this epigastric region the major portion is of stomach, pylorus, and the right lobe of liver, some portion of right lobe of liver along with the left lobe of liver. And along with the pancreas, duodenum, suprarenal capsule, and a part of the kidney. While in the left hypochondriac, fundus of the stomach, spleen, extremity of pancreas, and the splenic flexure of the colon, along with the part of left kidney. Remember, the hepatic flexure of the colon consists of the ascending colon combined with the transverse colon, where the splenic flexure comprise of the where the transverse colon joined with the descending colon. Okay, then come right lumbar region. Right lumbar region consists of ascending colon and the part of right kidney, some convolution of the small intestine. While the left lumbar region consists of descending colon, part of omentum, left kidney, some convolution of small intestine. And the umbilical region consists of transverse colon, part of great omentum and mesentery, transverse part of duodenum, some convolution of the jejunum and ileum, and a part of both kidneys are present in the umbilical region. As you can see, this is a transverse colon, jejunum and ileum part. Okay, so now the right inguinal region. Right inguinal region are the cecum and the vermiform appendix, while the hypogastric region consists of convolution of the small intestine, bladder in children and in adult if distended uterus during the pregnancy. So here came very important part that otherwise the uterus is small in size, while during pregnancy it enlarge and it can enlarge up to the hypogastric region as well as to the umbilicus region also, while the left inguinal region sigmoid flexure of the colon is present. As I told you earlier, the second classification of abdominal cavity, we classified the abdominal cavity into the four regions by an imaginary line into the right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant, which is divided by the median and transumbilical plane, the vertical medial line and the horizontal transumbilical plane. As you can see in this diagram, the abdominal cavity is divided by the median line and the transumbilical plane, which divide the abdominal cavity into right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant. So the major organs in each quadrants are the right upper quadrant liver consists of liver, gallbladder, duodenum and the right kidney, while the left upper quadrant majorly comprise of the stomach, spleen, pancreas, left kidney. The most important part of the left right lower quadrant is the appendix and the cecum, while the left lower quadrant is the sigmoid colon. So the reason behind the division of these abdominal cavity is we are going to discuss detailed in the clinical correlation, but in basic sciences you just know all the divisions and regarding all the imaginary lines, and the most important, the each the contents or the organs present in each region and the quadrant of the abdominal cavity, because it has a great importance in the clinical correlation. Now we are going to discuss the surface anatomy of different organ. Start with the liver. So as discussed earlier, the liver is located mainly in right upper quadrant, and if we are going to see in the region wise, so its main part is present in the right hypochondriac region along with the epigastrium, while the upper border of fifth rib at the midclavicular line, lower border follows the costal margin. Here is the clinical point of view that it moves with the respiration, and the right dome of diaphragm, which are we also going to discuss in the variable position of diaphragm, that due to liver the position of diaphragm in right side is lower as compared to the left side. As you can see in this diagram, the upper border at the fifth rib at the level of midclavicular line, while the lower border reach the costal margin of 10th rib, and you can see it is present in the right hypochondriac region as well as epigastrium, or if we are divide the right upper quadrant, major part of the liver is present in the right upper quadrant. Okay, now surface anatomy of gallbladder. Gallbladder is one of the most important topic because it is very common. The gallstone is very common in Pakistani population, especially in females. So, the clinical point of view, you must know the location of gallbladder. So, it is located at intersection of right mid-clavicular line and the costal margin, which is also called the Murphy's point. As you can see here, the fundus of gallbladder, there are two cross present, that is called the Murphy's point. And if we can see the abdominal regions, the gallbladder present in the epigastrium region, while if the in the right upper quadrant mainly present the gallbladder. As you can see, the fundus of gallbladder is clearly present in the epigastrium region. So the surface anatomy of gallbladder is very important in the cholecystitis examination. So the cholecystitis is basically the inflammation of gallbladder. It is again a clinical terms which you must know that the inflammation of gallbladder is called cholecystitis, and there is a tenderness present in the Murphy's point of the patient, and there is also a referred pain to the shoulder as the dermatome of the nerve of the gallbladder is at the shoulder point. Now come to the surface anatomy of stomach. So the major part of stomach are present in the epigastric and left hypochondrium region, while the cardia left of T11 with 11 thoracic vertebrae, while the fundus under the left dome of diaphragm. Greater curvature of the stomach is extended inferiorly. As you can see in this image, the major part is present in the epigastric region, while the fundus and the body, some part of fundus and the body is present at the left hypochondriac region, while the pylorus antrum and the some part of body and fundus also present at the epigastric region. Now come to the surface anatomy of spleen. Spleen is located in the left hypochondrium between the 9th and 11th ribs, long axis parallel to the 10th rib. And the most important part, spleen is not palpable normally in healthy adult. So you can see this spleen is present at the mid axillary line between the 9th to 11th rib, long axis parallel to the 10th rib, and it is not normally palpable in healthy adult. Okay, so we discussed the surface anatomy of basically landmarks, bony landmarks of abdomen, after which we discussed the regions and quadrants of abdomen along with the contents. Then we discussed the four major organ, the surface anatomy of liver, gallbladder, stomach and spleen. Now come to the diaphragm. So before diaphragm, I think we should discuss the clinical correlation of the surface anatomy of abdomen, because as I told earlier, the most important thing is the referred pain. We are learning the surface anatomy of abdomen for the examination point of view as well as the treatment point of view. On examination point of view, we must know the dermatomal patterns, and for the treatment of point of view, we are uh, telling about the surgical incisions. So first of all, examination point of view, one example I gave earlier, that the Murphy's point and the referred pain in the cholecystitis, which is felt at the shoulder. Another example mentioned here is the early appendicitis pain is often felt at the 10th thoracic vertebrae umbilical level before shifting to the right lower quadrant. So here is the most important thing. The cholecystitis pain is referred, while the appendicitis pain is shifted. Initially start at the level of T10 umbilicus, then shift to the right lower quadrant. Then as I told you that we are learning the surface anatomy of abdomen for the examination point of view as well as treatment point of view. So here is the most important. There is a McBurney point, which is located 1/3 of the distance from the anterior superior iliac spine to the umbilicus. It is surface projection of the base of appendix and primary site for assessing the appendicitis. To reach the appendix, basically, we have to give the incision at McBurney point. Similarly, the surgical incision linea alba for the linea alba, basically it is the bloodless midline, and the arcuate line where the rectus sheath changes is critical for safe surgical entry. So one of the most important procedure in general surgery is the laparotomy, in which we are searching the inside the whole abdomen. So the linea alba is the point in which we give the incision to reach the inside abdomen. Similarly, hernias, the inguinal canal located just above the inguinal ligament is a common site for hernias, as well as the clinical distinguish between the indirect and direct hernias based on the relationship to the inferior epigastric vessels. So if we summarize, the surface anatomy aids clinical examination, help to localize organs and pathology, essential for medical practice. Thank you, and if you have any queries, you can reach me at the Department of Anatomy or in the LMS comment section. Thank you so much.